First is I'm going to sanitize my hands to prevent any contamination. Next is I'm going to introduce myself to the client. Good morning, ma'am. My name is Sharon Alcin Napang. I'm your student nurse for today. Next is I'm going to identify the patient. May I ask, ma'am, what is your name, ma'am? Okay po, ma'am. Thank you po, ma'am. Next is I'm going to explain the client about the tracheostomy care. Tracheostomy care is an opening po, ma'am, made by incision through the neck into the trachea. Next is I'm going to position the client in semi-collar position. A semi-collar position promotes lungs expansion and also prevent back strain. Next is I'm going to place a towel on the patient's chest. A towel or linen pad helps to prevent soiling from the patient's gown. Next is I'm going to wear my gloves. Then I'm going to insert now. Now I'm done wearing my gloves. Next is I'm going to suction the tracheostomy tube. After I remove, I'm going to discharge, and also I'm going to remove also my gloves. And please seal in the proper place. Next is I'm going to place the tracheostomy care on the upper bed table. Then I'm going to open. Next is I'm going to pour the hydrogen peroxide into the sterile solution. This is the hydrogen peroxide. Next is the normal saline solution. The next is I'm going to open the 3 4x4 gauze pads. The first 4x4 gauze pads that I'm going to open, I'm going to wet into the hydrogen peroxide. Going to wet into the hydrogen peroxide. The next gauze pads that I'm going to open, I'm going to wet on the normal saline solution. I'm going to start to wet now into the normal saline solution. The third gauze pads is I'm not going to wet because let's keep it not too wet. It's not the required is the 2 only in the hydrogen peroxide and normal saline solution, and the last is we're not going to wet because we're gonna use it later. Next is I'm going to open the cotton applicator. Then I'm going to wet on the hydrogen peroxide and normal saline solution. For hydrogen peroxide. Next is for the normal saline solution. Next is I'm going to wear my sterile gloves. Now I'm going to wear my gloves. Next is I'm going to unlock and remove the inner cannula with my non-dominant hand and care for it accordingly. Next is I'm going to remove the oxygen source using my non-dominant hand, and I'm going to reinsert the tracheostomy. I'm going to remove, then I'm going to reinsert the inner cannula. Next is I'm going to clean the stoma under the face plate with the cotton applicator. Use once only cotton applicator, then discharge it. After using, discharge it. I'm going to clean the surface of the face plate around the skin by using the gauze pad by hydrogen peroxide. So I'm going to start now. Use only one gauze pads. After using, you discharge it. Next is I'm going to dry the skin by the remaining dry gauze pads. Then I'm going to place in the proper place. So next is I'm going to insert a pre-cut sterile tracheostomy. Next is I'm going also fold 4x4 gauze. I'm going to do a V shape. After that, I'm going to dispose all the equipment that I'm using during the procedure. After I remove all the materials, especially the gloves, I'm going to sanitize my hands to prevent any contamination. After I sanitize my hands, I'm going to place the patient in the proper position. For the evaluation, assess the area around the stoma site for sign and skin breakdown. Next is evaluate the patient tolerance during the procedure. For the documentation, document the time, date that you performed the tracheostomy care. Next is note the condition of the stoma and the skin around the stoma site. Next is note the patient tolerance during the procedure. For the assessment, assess the respiratory status including respiratory rate, depth, rhythm, breath sounds, color, and pulse oximetry. For the rationale, helps to determine whether the patient can tolerate tracheostomy care. For the number 2 assessment, assess the tracheostomy site for drainage, redness, and swelling. For the rationale, drainage, redness, and swelling may indicate infection. Hi or good morning or good afternoon, ma'am. My name is Sharon Elsie Napang, and today I'll be performing my return demonstration of tracheostomy care. A tracheostomy care is an opening made by incision through the neck into the trachea. My clinical instructor is Ma'am Cherry Go.